My name is Gavin Stone. I'm the news editor for the Richmond County Daily Journal, and I'm sitting here with the soon-to-be former Health Director Tommy Jarrell. We're talking today about COVID and Tommy's career and stuff. And it's been what, 31 years now? Is that right?
That's correct.
Is that right? Can you start by just telling me where we're at with COVID at this point, and just what the situation is from your perspective in Richmond County?
Sure. Speaking locally in Richmond County, we publish a daily report at least Monday through Friday to try to keep the residents in Richmond County aware of what's going on. Obviously, the number of positive cases in Richmond County has certainly trended downward for the last several months, which we're certainly pleased to see those numbers trend downward. We've been averaging less than 10 a day now for the last few months. Hospitalizations are trending downward. Our residents continue to seek the COVID vaccination, although the number of vaccinations are also trending downward, which we're glad to see people continue to seek vaccinations, but we would like to see a larger number seek those vaccinations, because we know the vaccinations are working, because the hospitalizations for those being vaccinated have practically been eliminated, and those that are being hospitalized for COVID tend to be those that have not received the vaccination at this point, and the deaths tend to be among those who have not received the vaccination, and the deaths also tend to be not only locally but nationally as well, tend to be lowering to those who have not been vaccinated. So that is the biggest concern we have now, is seeking that younger population to get them vaccinated so that we can reduce their chance of contracting COVID and also being hospitalized or potentially dead.
Right. Is there, are you seeing people, relax too much? I mean, there is a sense that it's kind of, the pandemic is over a little bit for some people. Is that something that you're seeing? You think people are maybe relaxing too much at this point?
Well, I think at this point that this has been going on now for 15 or so months, and I think people are honestly just tired of being pent up for so long, and everyone, including myself, we're all ready for a release, and the biggest way to move forward is just to make sure we have protected ourselves, and the best way we can protect ourselves is to seek a vaccination and to do the best we can do at trying to socially distance as much as possible. So I don't think it's unreasonable to get back out and to start mingling among people, but to certainly try to seek the vaccination and to try to avoid being in very large, closely crowded groups of people. But it's time to get back out, and it's time to mingle with people, but we just need to attempt to do as much as we can safely.
Yeah. Okay. What challenges do you see going forward with the pandemic? For the staff that are going to be taking over in your place, what do you anticipate them dealing with in relation to the pandemic going forward? Are variants, or just are there lingering issues that the health department is going to be dealing with?
Well, there's certainly some new variants that are out there, and there will probably be some other new variants that will appear in the coming months that we're not even aware of at this point, that's going to impact not only our community but nationally as well as the world, that are going to have to be dealt with, and we probably don't even know what some of those are at this point. But the biggest challenge will be to just continue to reach that group that have been resistant or have either delayed seeking the vaccine, is to continue encouraging that group to seek a vaccine and to receive a vaccine. Vaccines are widely available now, so it's not a matter of vaccine not being available. It's just a matter of encouraging everyone who has not received the vaccine to receive the vaccine, and there are very likely going to be some spikes of positive COVID cases coming up in the months later this year. I think that will occur. I don't think it will be as bad as it's been in the past, but I think there's going to be some spikes. So the more we can do as a society to protect ourselves, hopefully we won't experience anything like we did in the past year with the lockdowns and the required mask mandates. So hopefully, if everyone will take some responsibility, we won't have to go back to those kind of measures in the future.
Are you guys requesting vaccine doses in anticipation for spikes in cases, or have your requests for doses dropped in the sort of slower?
We're certainly not requesting the number of vaccines we were a couple of months ago.
Mm-hmm.
But vaccine availability is there, so we can receive it at any point that we need vaccine. We have a plentiful supply on hand. Because of storage, availability, and the vaccine expiration dates, we certainly don't want to have too much extra vaccine on hand at any given time, but we can get vaccine every week as it's needed, and we have enough on hand now for anyone who would come in within a couple of weeks seeking a vaccine, and we can very quickly get vaccine either through the state or through transfer from other providers who have an excess of vaccine available. So that's not an issue.
Okay. Just the COVID-19 dashboard said that as of yesterday was saying that Moore County has 26.9% of their population, or Richmond County has 26.9% of its population fully vaccinated, and Moore has 34.8% fully vaccinated. I don't know if that's accurate.
That number is not completely accurate. When you look at the North Carolina Department of Health and Human Services dashboard, the default with that is giving you North Carolina provider dashboard, but there's a link on there if you'll click all providers. That is the data you want to look at, because the data the state is reporting is only vaccine that's administered through the Department of Health and Human Services, and the federal government is also releasing separate vaccine to local pharmacies, to prisons, and to other entities that's not going through state government. So, and those are for Richmond County residents seeking vaccine at some other sources. So when you take and look at the total vaccine that's administered in the county, that vaccine is actually closer to 34% of the total population have actually received the vaccine. And if you look at the eligible population, which is age 12 and over, because anyone under the age of 12 is not eligible for the vaccine, we're actually at 40% of our population have received the vaccine. That is as of Tuesday of this week, 40% of our population. One distinction between Moore County and Richmond County is that Moore County has an extremely high percentage of their population that's elderly, and so the elderly has had access to the population for the greatest amount of time, and so it would be expected that they would have a higher percent of their population to be vaccinated. In Richmond County, if you look at the percent of our population 75 and over, 74% of our population 75 and over are fully vaccinated, and 72% of our population 65 to 74 are fully vaccinated. And those numbers compare very well with Moore County. It's just that they have such a high percentage of their total population over 65, so it's skewing their total population.
Because they've been eligible longer.
Because they've been eligible longer, and they're dealing with a very high percentage of their total population being elderly. So it's not to take away from them, but it's helping their numbers look much better.
Yeah.
Because they have a higher percentage of their total population being elderly.
Do you agree that based on the state, the vaccinations through state-provided vaccines, Richmond County was second behind Moore County with regards to like Anson, Scotland, Montgomery, Hope, and that, you go through our region.
In our region, I think that is correct.
Yeah.
The last data that I reviewed, that was correct.
What do you attribute that success to, and are there any areas for improvement there for Richmond County?
I think the biggest help in Richmond County is the partnership between the Richmond County Health Department and First Health Moore Regional Hospital, Richmond. From the very beginning, we developed a quick partnership where we pooled our staff and our vaccine together, and we held joint mass clinics, at times 5 days a week, at other times maybe not 5 days a week, but we held mass clinics for several months together, and we held those clinics at the hospital who had available space for us to utilize, and we had I think a seamless system in place to push a large quantity of people through. And to my knowledge, we were probably the only county in North Carolina that were working together with the hospital and health department, and it helped us tremendously get a larger percent of people in our community through by working together. And that partnership's been there for years. There's always been a great partnership between the hospital and the health department. So I think that was our biggest asset we had.
I didn't realize it was that unique, the partnership between First Health and
And I'm not saying there wasn't a partnership across the state, but I'm not aware of another partnership where the hospital and the health department in many communities, there may have been some partnerships, but this was truly where we joined our staff and our vaccine together to do this between the two entities. And I think that had the biggest impact on allowing us to get larger numbers of people through together.
Can you walk us through how you came to realize the severity of the pandemic? Because for my recollection was the first I really got the full scope of it was when you spoke to the school board in I believe March of last year. Can you just walk us through your sort of understanding of COVID and how it progressed early last year?
Sure. Earlier last year, actually I think probably in February, started to see very minimal COVID activity in North Carolina. And even in early March, the numbers started picking up across the state, and we were certainly monitoring that very closely each day. And Richmond, we were obviously excited to begin with. Richmond County was one of the last 10 counties in the state to even have a positive COVID case. Once we received our first positive case on April the 4th of 2020, and then 2 days later we had our first COVID death on April the 6th of 2020. The activity picked up very quickly, and so when I met with the school board right at that time, it's just like we knew very quickly that things were going to escalate very quickly because we saw that happen across the country. And we knew the activity was going to pick up quickly. And so even with that, we formed a partnership with the hospital very quickly to set up a testing COVID clinic where we shared staff with the hospital, and we began at the old Sand Hills Regional Campus, and our nurses and hospital staff worked together to set up COVID testing at the Sand Hills Regional Hospital. It later moved to the campus of to the Richmond campus, And we continued that for several months until we were able to get a testing site set up by the state behind the health department, which continues today.
Right.
And that site is on the health department campus, but it's operated by the state through a contract they have with a private entity that continues to this day doing free testing.
Are the extra staff that you guys had to take on from the state, are they still with Richmond County? Are they still working for the health department?
We still have some, they're temporary staff that we are using some grant funding that we received from the state, which came through the federal funds that were allocated to North Carolina. We do have currently three temporary part-time nurses, and then we have had some part-time clerical staff to help us with COVID activities, along with our own staff charging portions of their time to COVID-related activities. We've had our nursing staff and our clerical staff and other staff who have also been working in COVID, either testing activities, clinic vaccination activities, that have been charging their time out to the COVID efforts. And fortunately, we have received funding through the state from the federal government to help with those efforts.
What would you say some of the biggest challenges were as things picked up? And I know you guys had trouble with contact tracing and things like that. I mean, what did you guys run into along the way, and what did y'all do to respond to those?
Well, we had a couple of things going on simultaneously. We obviously, because of our limited staff, in trying to maintain our regular health department clinical services, while we were also pulling our staff to do COVID-related activities, really put a strain on our staff. And at the same time, in the midst of this, back in probably November to February, maybe early March, when the number of positive cases were really at high levels, we were really strained to keep up with contact tracing. The numbers were so high, trying to keep up with contact tracing really put a strain on us, and we had several months that we actually had to cancel all staff vacations, and we had staff working weekends. It was a strain on our staff for several months because we didn't have the staff, and there was a long period of time our staff worked at stressful levels, and fortunately at this point things are easing up a little bit as we're getting into the summer season, that we can allow staff to start taking a little bit of time off now and start to do some personal things, and still handle the COVID activity we have going on.
Okay. What impact do you think going forward COVID will have on people's relationship to health and just the way they interact with the public? I'm not sure how much you can speak to that, but as it relates to restaurants and like cleanliness and things like that, I mean, what kind of behavioral shifts have you guys seen, and what do you all anticipate going forward?
I think for at least the immediate future, there's behavior changes that have already occurred, and I think some of those may be permanent. Telemedicine has been very limited in the healthcare industry, but I think telemedicine is going to become more prevalent, and there's going to be more people that are interested in telemedicine now, so that they don't have to go to a provider's office. They can a lot of telemedicine was forced on people, or telehealth, during the pandemic, but some people and some providers got comfortable enough with it that I think it's going to move much faster in that direction than it probably would have had it not been for COVID. So I think that's going to be something to happen. Another thing, I think most people realize that there was practically no flu activity this past winter. And I think a lot of that had to do with a couple of factors. One is people were remaining fairly isolated from one another. People were not gathering in large groups. People were obviously doing a lot more personal hygiene, washing hands, hand sanitizer, cleaning surfaces. We were all wearing masks, so I don't think we were coughing and sneezing around each other, and people were staying home if they were sick. They were not going out and exposing other people. And so I think there's going to be a larger segment of our population that we may see wearing masks in the winter now than that's not something I think we ever saw very much at all prior to COVID. And not that I think it's going to be a mandate coming up unless there's another outbreak of COVID, but I think we may see people choose to wear a mask in certain seasons of the year voluntarily. If it's not for COVID, just to prevent other colds and viruses and flus in the future. And other personal things may change. Are we going to shake hands as much as we did in the past? Are we going to hug people? Are we going to do more elbow bumping and fisting with each other? Are we going to just change some of our personal habits? Some of that we've missed, and people have gone back and they're already doing it. I'm not saying it's gone, but I just wonder how much personal behavior people are going to change in the coming months and years. I think some personal behavior is going to change. Telehealth's going to change. Telemedicine's going to change. I think there's going to be some personal behavior. Not necessarily mandated. I just think some people are going to choose to do that.
Just because most people haven't lived through a new disease being on the scene. I mean, is it accurate to say that this is going to be part of the regular sort of annual vaccination and just sort of be like a thing that's sort of an ongoing problem like for society as a whole? Is that something that is it going to be like flu, cold, COVID, like all these things kind of being a regular thing?
At this point in time, I think it's going to certainly be around for a while. Several years ago when we were dealing with H1N1, which certainly not at the level COVID has been around, and SARS and some of the other things, what ended up happening with a lot of these other viruses or diseases is they ended up being kind of folded into the flu vaccine. So those that choose to take the flu vaccine each year, they're also receiving protection from some of these others. And my thought is, will there be a way that protection from COVID will be folded in to the flu vaccine along with some of these other things in the future? I don't know. The COVID vaccine, is a different type of vaccine, and whether or not the scientists will be able to fold that in as part of our annual flu vaccine, I don't know at this point. But I'm sure there are scientists trying to figure if there's a way to make that happen, so we're not being suggested we go out and take 2 or 3 different vaccines every year. It'd be nice to have one vaccine for those that choose to take the vaccine.
Right. And speaking of that, what would you say to someone who has either chosen not to get the vaccine or is sort of on the fence about whether they're going to get the vaccine? What would you say to someone who at this point?
Well, I obviously would encourage everyone to strongly consider receiving the vaccine. From a personal perspective, I would have a hard time living with myself if I were to contract the virus and then give it to someone and them to die from receiving the virus and knowing that it came from me, I would have a personal guilt I wouldn't want to live with. So I would hate to know, and that is a personal, I'm not putting a guilt trip on anyone. I would have a personal difficult time knowing, could I have prevented that had I taken the vaccine? And I don't want that on my conscience. I'm not an advocate for mandating that someone has to take the vaccine, but I'm just, for my conscience, I want to do what I can do to protect others as well as protect myself.
Right.
You know, I want to protect myself, but I also want to protect others. I have elderly relatives, I have elderly friends, I have other people who may not be elderly, but they have serious health problems that I want to be around, and I don't want to risk giving them something that I could hopefully prevent by taking a vaccine. And I feel much better knowing I have received the vaccine. We all know the vaccine's not 100%, but nothing in life is 100%.
Right.
So I feel much better knowing I have received the vaccine, and hopefully I have protected myself. In essence, I'm protecting other people by protecting myself.
Right. With the where we're at now with the pandemic, what is your stance on masks, and where do you see the consensus of the medical community on the necessity of wearing masks in public?
At this point, I'm in agreement with the decision that North Carolina has made regarding mask usage. If someone is fully vaccinated, I'm in agreement that in most settings there is not a need to wear a mask at this point. Obviously, there continues to be a need to wear a mask in certain settings, such as in a hospital or in a jail or in an office clinical setting. There is a need. If you're in a very large venue where people are still crowded together, it's probably best to wear a mask at this point. But otherwise, I think for a fully vaccinated person, it's okay not to require a mask. If someone still feels more comfortable wearing a mask, then by all means, they should continue wearing it. If it makes them feel better to wear a mask, they should continue doing it, but not mandate wearing a mask at this point.
Okay. The last question, really, just what do you have planned for yourself, and how do you feel at this point? I mean, it being your last day. I mean, what's next for you personally?
Well, personally, for a couple of months, I'm gonna kind of wind down a little bit and just enjoy some time with my family and do a little bit of traveling. And then in the fall, I'll start looking for some other opportunities to get out and see what's next in life. I'm not sure what that'll be at this point, but I just want a couple of months to kind of unwind a little bit and relax and do a little fun stuff that I haven't had an opportunity to do.
Yeah.
And then look for something, see what's available.
Any ideas what that might be at this point?
I don't at this point.
I am. All right. Well, I appreciate your time, Tommy. Thank you for talking to us, and I really appreciate it. Congratulations on your retirement.
Thank you, appreciate it.
We should probably fist bump or whatever. Yeah, there we go. All right, yeah, there we go. Cool.